Hello and welcome everybody to part 2 of why to choose an integrative approach to your healthcare. We're really focused on getting to the cause of a problem, which can allow your body to heal and reverse it. But before we go into that, I do want to really appreciate those of you that are on part 2, especially if you're on part 2 near the release date, just because it shows your commitment to yourself, to your family, to the people you love and care about, that you're taking time to invest in yourself, expand your knowledge, and then more, and probably most importantly, make the best decisions for you for lifestyle changes or confirmations that you're working to make. I do have a confession. I did forget to put the first mystery word in the last talk. So the first mystery word is integrative. So I'll say that again. The first mystery word is integrative. So as we get started today, a big portion of the last one was really to explain the downsides of some of the medications or chronic conditions that people deal with, and why it would be so valuable to make time, effort, money available to making yourself healthier. One of my best friends said to me one time after they lost a close friend of theirs that was the same age, that was in their late 30s. He said, you'll never regret spending time with your family, and you'll never regret investing in your health. There's no guarantees, but the more that you do invest in your health, the better off you are. So we're going to spend some time today just covering a few topics on some things to I'm going to say expand your mind on what's possible with an integrative approach. Integrative is not just supplements and dietary modifications or recommending chiropractic or something like that. Integrative also is testing things that get to the cause, not testing things that put you on a drug. That's one of the things that I think is a misconception. Like if you go to your doctor and you think like they test you for allergies, let's say, well, with the blood test for allergies, there's either a 6 or a 39-point test. And in reality, there are tests that are 600 different points, 600 different foods, outside environmental factors, whatever it might be. And yet that's just not done in our current medical system. It's not right or wrong, but it's not done. So there are other options. If you think about cholesterol, as I mentioned on the last talk, there are laboratories that break down your cholesterol way beyond LDL. And if you last year at this time read the paleocardiologist with us, you'll know that there are 5 different types of LDL, the quote unquote bad cholesterol. And we have a lab that we can often bill through your insurance and actually check the differences so that you can see if your LDL is high, is it concerning? Is a statin harmful for you? Can we check your genetic makeup? Things like that. Additionally, for instance, for thyroid, what are some of the causes for thyroid? Well, first of all, one of them is toxicity. The thyroid is arguably the most sensitive organ to toxicity, so different detox protocols are available, really breaking down the thyroid into a more in-depth than just hyper or hypo, Hashimoto's, things like that. Additionally, we can test for iodine. So, with thyroid, there are iodine deficiencies. Some people have over iodine, some people have too much selenium, so we can test for some of those things. If you look at stress, the stress on your body, or for instance, depression or antidepressants, these things really can be looked at all the way down to the neurotransmitter level. And I'm not going to repeat some of this because we talked about it last time, but in our Mountain program, which if you've never heard of Mountain before, our Mountain program stands for Metabolics, Toxicity, and Nutrition. So really it's just an acronym for overall health improvement, looking at how do you detox your body, how do you add nutrition to your body, how do you support your metabolism or stress organs, which is thyroid, adrenal, sex organs, things like that. But we can actually test to see how burned out or how fatigued your adrenal glands are, and then help you with supplementation on how to support it, what things to cut out, what things to add in. We have all sorts of liver function detoxes, whether it's liver flushes, liver support, detoxes, which if your body is able to kick out more of the crap that's exposed to, it often reduces inflammation, which can reduce pain and a variety of other factors. One statistic that I've mentioned quite a few times is that according to, again, in the book, The Paleocardiologist, they talk about the average American today comes in contact with more toxicity in 2 days than someone 100 years ago would come in contact with in their entire lifetime. So certainly, God provided us with detox organs, but what's the threshold? Never before in world history have we been exposed to a level of toxicity that currently is. I mean, there are thousands of toxins in food that the FDA doesn't even require to be on the label. There's things like, when a potato chip is deep fried, it might say like potatoes, salt, and whatever the fat it's fried in. But for instance, when it's thrown in that vat to fry, it foams, and they actually put an anti-foaming chemical in it, which of course is left on the chip at some level. I mean, things like that just don't even have to be listed on the label. So you get exposed to all sorts of things, whether it's indoor or outdoor pollution, makeups, cosmetics, personal care products, food, additives, food colorings, and helping your liver detox, helping your body with insulin sensitivity. So one of the things that I first noticed with the Mountain program is that people often had significantly better insulin sensitivity. So people with type 2 diabetes, when they made the dietary changes, they often had a much higher success rate. And many of you that have watched the Mountain program either online or have come to the live seminars, Don, you probably know who Don is. Don personally, without my asking, just volunteered to share the benefits that's happened in his life because of so many decades of trying to control his type 2 diabetes, and jumping on the Mountain program was the first time in a long time that he was able with his doctor to reduce his medication, take strain off his pancreas, and live a better life, lose weight, all that kind of stuff. Additionally, when you increase your insulin sensitivity, your body's ability to burn fat goes up. So the fat hormone leptin goes up dramatically. So, you think about that, fat hormones or fat burning hormones could really change the way that you look. These things with adrenals can often affect things like testosterone or estrogen. So testosterone is really big for muscle tone as you age. But what's really bad for muscle tone as you age? Cholesterol drugs. They can destroy your muscles. So again, getting to the root cause. Another really misunderstood concept is parasites. People often have parasites in their body, whether they get it through eating pork or whether they get it through, a variety of other factors, but certain parasites can wreak havoc on your digestive tract. They can do, and so killing parasites through certain programs that we do can really help your body function better. Now, for a better, more in-depth assessment of parasites, you'll have to watch the full Mountain video, which you can request by either coming into the office and requesting it be sent to you. You can request it whenever you're in the clinic for an adjustment. You can request it when you're seeing nurse practitioner Abby with Integrative Medical. But we have a more than 60-minute program just on the Mountain program itself for gut heal and seal. For those people that think they might have leaky gut, bloating. I just talked to Abby about this on Wednesday, but she talked about how the gut heal and seal program is shown to affect serotonin or mood. Keep in mind, 80% of serotonin production is in your gut. So if your gut's messed up, you really could have more depression, anxiety, all sorts of things. And by healing it, you could notice a significant difference. It can affect headaches. It can affect digestion, bloating, all sorts of stuff. So again, what we really specialize in is when you come in for an integrative medical appointment, the reason it's 1 hour long is because it's going to do a full assessment on what you might need or direct you in the right course. Additionally, there might be something more simple, like some people with acid reflux is not as severe, and they'll moderately modify their diet, and or they'll do something like the supplement Max GI for a few months and realign their digestive tract a little less intensely, and still they'll notice a significant improvement in acid reflux or bloating. They might not need that medication that we talked about at the last seminar. Something as simple as testing your magnesium levels could help with sleep. It could help with blood pressure. And if you're sitting there going, why in the heck could magnesium help with blood pressure? Well, magnesium deficiency, which many Americans have, causes muscle tension. And keep in mind, your heart and your arteries are muscles. And so by relaxing the arteries, you can relax your blood pressure. Another great thing for that is exercise, of course, to strengthen those muscles. There's other things like right now, so many people are concerned with their immune system, and simple things like vitamin D and vitamin C consumption. You might have heard of zinc for certain things that are going on right now, but covering your system with simply a whole food multivitamin. I can't tell you how many people come in and they're taking like a Walmart or a Walgreens brand multivitamin, Centrum Silver, which are just garbage. They just don't work. I mean, there's studies that show they don't work, but these whole food multivitamins can cover, if you don't eat perfect, they can cover the gaps. They can cover a lot of the holes. Additionally, heavy metal toxicity. You get heavy metal toxicity from everything from consumption of certain foods, like, you know that thick candy shell that melts in your mouth and not in your hand? M&M's titanium is the ingredient that causes it to have a thick candy shell. There's aluminum in deodorant, or antiperspirant, not deodorant, but antiperspirant. You get aluminum and mercury in vaccinations in many cases. You also get that if you have amalgam fillings in your mouth. And so you get exposed to all these different things. Aluminum is the most common heavy metal, and you can even get that, for instance, from leaching when like pop cans or beer cans or even sparkling water or something like that, when it's stored at high temperatures in the warehouse or something like that over the summer, in certain times from pots and pans. There's all these different ways that you get heavy metal toxicity, and we can test for that, and that may reduce a variety of things, but one of the big things that I always personally think is so important is those things are linked to dementia and Alzheimer's. They're linked to skin issues. When people have skin problems and they put cortisone on it, quite frankly, it doesn't just hurt. It breaks my heart to see that, because it is shoving everything back in. It's robbing Peter to pay Paul. Many of you know that my wife had that experience as a child with cortisone, and she's still dealing with the after effects of a medication, decades later, from having cortisone recommended by the doctor. And I understand why they did it. Who wants to see a child suffer or be in pain? But the aftermath is so much worse than the initial problem. And that's what so many people miss. Is, I get it. Who wants to hear their kid scream with an ear infection? But the antibiotic often is not the answer. Who wants to have their skin look rough? But the cortisone is not the cause. It's not the answer. It manages the problem, and it often actually perpetuates the problem until you get to the root cause. And so an integrative focus, along with great chiropractic care, can really help allow you to get to the root cause of the problem. So I'm going to talk about a few of our programs here, and then I'm also going to talk about ways to help with cartilage regrowth and joint pain. So from an integrative perspective, we have 3 actual specific programs, and then we also have protocols. So protocols first, we have protocols for blood pressure, thyroid, cholesterol, mood, sleep. So if you're struggling with something like that, making an appointment with Integrative Medical and helping to assess getting to the root cause could be radically influential for you. And I say could because you still have to take the action steps, but we have protocols for all sorts of stuff that are common things that people deal with. I say common, not normal. Why is that? Because it's common. It's not normal to have these things. And so additionally, for programs, we have the Gut Heal and Seal program. And what that does is we test for food allergies, environmental allergens, things that you can cut out. We also test to see what your gut microbiome, which is really like saying what's the garden or the different bacteria in your intestinal tract look like, and what do you need to kill off, and what do you need to support or replant. So putting the right type of probiotics. I think people think sometimes that just taking a probiotic is the answer. There are so many different types of probiotics, depending on where your deficiencies or overgrowths in, you could be doing more harm than good if you're not testing for it. Additionally, the NutriVal. The NutriVal is the most comprehensive testing for everything from heavy metals to gut microbiome to vitamin deficiencies, fatty acid ratios for inflammation, omega-3s to omega-6s to omega-9s, all that can be tested for, and it's just not going to be done at your doctor. So the NutriVal is a great program. And then lastly, the Mountain program, that was our flagship program when we first started Integrative approaches. And the Mountain program has detox stuff, parasite, adrenal and thyroid stuff, weight loss related things. I mean, there's just so much available. And what I think is cool is instead of you having to decide, you come in with the problem or the solution that you want, and then Abby can help you sort through and really solve it. And of course, if you need an even more in-depth functional medicine approach, we have the ability to refer or to do that. So there's just lots of great choices, lots of great options. And again, what we've changed to, what I suggest is just simply, you can make, again, the 15-minute or the 60-minute appointment. A 15-minute appointment is simply to ask questions about a program. We don't actually go into your issues. The 60-minute appointment is when we go into your issues. And keep in mind, we are a network with the majority of the major insurance companies. And if not, we do have that first appointment available for $125 at a unique cash rate. So you really have a great availability to sort through all this kind of stuff. Now, transitioning, let's talk about cartilage damage, joint pain, things that have just been from pure wear and tear degenerated over time. And so I see quite a few people for things that are problematic outside their spine: shoulders, elbows, wrists, fingers, hips, knees, ankles, and feet. Many times we have people that just struggle with degenerative conditions. They have damage to their tendons, they have damage to their ligaments, they have damage to their soft tissue from twisting on their knee or spraining their ankle a bunch of times or whatever it might be. And I have what I call the 5-point approach. If you have any of those issues, utilizing chiropractic or physical therapy first is the least invasive, the most cost-effective approach for either one of those things. But if you get beyond that, the standard medical approach is to do either steroid injections or surgery. Now, keep in mind, a lot of people don't know the downsides of steroids. Different from topical steroids that can damage your skin or shove everything back in, injected steroids are anti-inflammatory. My explanation, which is mostly opinion, it's kind of like you threw 100 ibuprofen in it, and it lasts for a month, 3 months, 6 months, maybe a year. But the downside of that is steroids are degenerative, meaning that the same arthritic joint or the same cartilage damage that's there will actually be sped up by the short-term pain relief you get from a steroid injection. And again, a lot of people don't know that it does make it worse. A steroid injection makes you more likely to need a total knee replacement, a total hip replacement, have back surgery. Wherever they put that, it actually speeds up, because not only does the steroid have a negative effect, but keep in mind, does that get to the cause? Was the pain a lack of steroid? Of course not. It was inflammation, likely from misalignment or an injury. And so, for instance, if you look at chiropractic, we try to fix the alignment of the joint to take the strain off it. With physical therapy, they're trying to work on the musculature to help strengthen, stabilize, or protect the joint. The steroid damages the joint, but it gives you relief in the short term. Like I said, robbing Peter to pay Paul. If you look at surgery either adds or takes away, meaning that it adds plates, screws, rods, whatever it might be, or it cuts out part of that. And while that might be necessary in certain instances, it doesn't actually fix what was causing that in the first place. So again, you think about back surgery. When I just had a guy last night that he's so close to needing back surgery, and it's like he was 35 years old. Well, some studies show that if you're under 40, you'll likely have 5 back surgeries in your life. If you're over, a cumulative meta-analysis that I've seen shows that you'll likely have 3. You think about it, many people, when they have back surgery, they think it's forever, but actually because they don't get to the root cause, it puts more strain above and below the problem. and yet perpetuates the problem. And so anytime you can get to the root cause. So I'm a big advocate of stem cells, only in situations where the pain is significant enough that it's restrictive. Today, at the time of this recording, in about 2 hours, we're going to be doing stem cells on someone's shoulders who is being limited from pain, range of motion, sleep. And then following that, on a good friend of mine, we're doing a stem cell injection on her knee. She stepped out of the RV when they were on a camping trip. She was holding her child to keep from falling over and possibly injuring her child. Her ankle rolled over, her knee gave, and she had a partial tear in her knee. And so stem cells can help her avoid surgery. I think many of you have heard me say this, but my mom, we've known for quite a while, has a genetic difference in her hip that causes wear and tear that's beyond what a normal person can deal with. And so it's wearing out the cartilage. And she was dealing with a lot of pain in her hip. She'd already had her one hip replaced at a younger than average age. And this time, instead of a hip replacement, she opted for the stem cell injection. And that was about 6 weeks ago. And right now she's in almost no pain, sleeping at night. It's even helping with her chiropractic because her hips are more balanced because her muscles aren't constantly compensating. So, we do use this in our family. My grandmother's had them in both her knees and both her shoulders. She was told that her shoulders were so degenerated that she wasn't even a candidate for shoulder replacement surgery, yet it helped her be able to do her own hair, wash her hair, increase range of motion. There's just so much potential, but I am going to take about 10 minutes here and just explain what stem cells are, which is really another term for regenerative medicine. In chiropractic, we talk about what if we could help your body heal itself? What if chiropractic adds nothing and it takes nothing away? It aligns your spine in a way that allows your neurology, which is really your brain, to heal itself. Similarly, stem cells allow your body's innate intelligence to use what they call an undifferentiated cell to turn it into more cartilage, more ligament, more tendon, whatever it might be. Now, this is the short version. If you need more information or want more information, I do have a 40-minute video, again, that I can send you. So you can either private message me, you can post your email address in the viewer thing here. You can send us an email, you can ask in the clinic, but that's really what stem cells are doing. So if you have degeneration or arthritis in, let's say, your knee joint, you can put an injection in there and allow it to help attach to the cartilage, regrow some of the cartilage, and help with overall pain, discomfort, functionality. I've said this many times. Here's my last testimonial example. Another one of my best chiropractic friends, he was a college wrestler, and he'd had 3 surgeries on his meniscus, and he decided he wanted to run a marathon about 3 years ago, and he couldn't even run 3 miles. Not because he wasn't in the physical shape, but because his knee hurt so bad. Now, he had 1 injection with stem cells, and last year he ran a marathon. I was at his house in March, and they ran 12 miles in a training exercise. Like, they're training doing half marathons, full marathons. They're doing a 31-mile adventure race out in Idaho in about 2 months. So you think about that, helped repair the cartilage and allow his knee to do what he wanted to do. And it's 3 years and counting, and they are absolutely pounding on it, and it's holding up great. So that's what's possible. And regenerative medicine is just what it sounds like. It helps the body regenerate itself. Now, like I said, stem cells are an undifferentiated cell. So what that means is it hasn't turned into bone, cartilage, an organ, or whatever it might be. Now, where do we get these from? There are people who take them out of their own body, like they'll drill into their hip or something. But the older you get, and I'll show you that on this chart in just a moment, the older you get, the less stem cells you make. And so there's less success if you're an adult trying to derive your own stem cells. Now, this is something that's been done for a long time with cancer treatment. You've probably heard of bone marrow transplants. Again, that's what stem cells are. They drill into the bone marrow. They take the stem cells, they grow them, and then they put them back into your body. Now, with cancer, they're doing it through an IV. There is a lot of research on many other conditions that stem cells could help with. But right now, the only thing that's approved for use is to do them for joint pain or joint discomfort. So stem cells turn into something else. What do? Because they're a live cell, it's not just what you put into your body, but how many times they replicate. You think about when somebody takes ibuprofen for an injury, yes, it might reduce the pain, but it actually slows healing. Ibuprofen or NSAIDs actually slow growth factors that allow your body to repair. So it helps with the pain, but it actually slows the healing. Stem cells can reduce inflammation, therefore improving pain. They can fight cell death. They can self-replicate. So they replicate, they estimate for 3 to 6 months, which is when the net max benefit of doing stem cells are. And they can differentiate into anything from bone to fat to cartilage to muscle to tendons. I mean, this is such a cool idea, is allow your body to heal itself. Now, one other thing to talk about, not all stem cells are created equal. And not that they're not created, but they're not harvested equally. They're not from quality sources. So the stem cells that we use are from one of only a few FDA certified or checked, assessed labs. So you can get a stem cell that the lab has never been, I don't know what you call it, but observed by the FDA. So you actually have to opt in to do that. I know for a while, I used to drive to Chicago, and there were all these stem cell billboards. A lot of times stem cells, if they're not kept at the right temperature, if they're not harvested fresh, they can be non-usable, and they can be injected into a joint, and they're worthless. So you want to make sure you're getting it from a quality source. And the reason we started doing this versus referring it is I was looking at it originally for a family member. My wife had a shoulder surgery, and we were looking at, okay, so if we're going to help other people avoid surgery, where do we send them? And at the time, we had to send them all the way to Indianapolis. That was the closest place that I personally knew of that I could recommend stem cell injections. And who wants to drive 4.5 hours? So we contracted with a company called True Health. They come in about once a month. They bring someone who does this for a living. They're very good. Her name's Kalila. She's a physician's assistant, and she can assess the joint and inject the stem cells into the right places and help your body have the best chance at healing. But these are from umbilical cord blood. So I said this, I'm going to put this slide up as large as I can. So if you look here, umbilical cord blood, why would we do that? These are from pre-planned C-sections. And what they do is they take the umbilical cord blood, which would normally be thrown away. So it's not taking away from the child or the mother. And they use the stem cells in it. They harvest or extract it to be used for joints. So the reason I think this slide is so important, when a newborn is born, they have 1 stem cell per 10,000 cells in their body. And keep in mind, you have trillions and trillions of cells in your body. By the time you're a teenager, it's gone down 1,000%, from 1 in 10,000 to 1 in 100,000. By the time you're 35, 1 in 250,000. By the time you're 50, 1 in 400,000. By the time you're 80, 1 in 2 million. 1 in 2 million stem cells. So why don't your knees regenerate as well when you're 80 as when you're 18? Well, a big part is the ability for your body to differentiate into these different cells. And that's why I think it's so important to get it from the right type. I do get the question because there was some concern about safety. The ones that we use are obtained, as I said, from an FDA certified and regulated blood bank. They're pre-screened. They're tested for all this stuff. If you can see it, if you're watching on your phone, everything from all the required things and then some: HIV, hepatitis, West Nile, Lyme's disease, all sorts of stuff, Epstein-Barr. So they're tested to make sure that you're putting only things in your body that are safe. They're also added to, so your body to multiply effectively, you not only need the stem cells, but signaling things, growth factors. One of the big things, hyaluronic acid, there's proteins and electrolytes. So this is a blend of all the things you would need. I look at it like scaffolding. If you're painting the ceiling or if you're building a wall, you need the scaffolding or the support to do so. The growth factors, the hyaluronic acid, the cytokines, this is a scaffolding to give you the best opportunity for them to work well. And like I said, in our clinic, you have the ability to be assessed for shoulders, knees, elbows, hands, feet, ankles, and hips. So if you wanted your back done, actually UW-Madison does do injections into the back. I wouldn't necessarily recommend it. There's not as much research done on that, only for like severe herniations, but it is possible even for discs. But we can do everything except the spine right in the clinic. And I think that's pretty cool. It helps you avoid surgery. It helps you avoid dangerous drugs. It helps you not rely on pain medication. It can even help your chiropractic treatment work more effectively. As I mentioned, we have there's research being conducted. There's thousands of studies done on all sorts of things. And I'm just going to put this thing up here quickly. But, Parkinson's disease, Alzheimer's, stroke recovery, myasthenia gravis, fibromyalgia. There's research being done. But like I said, right now, the best thing or the most approved thing is for joint pain. If you want to look this up, you can look up that, like it says on there, 5,300 current trials. PubMed.gov, clinicaltrials.gov. You can read more about this if you're interested in that part of it. So I'm going to go through very briefly safety. Hopefully I address safety. The only contraindication to having stem cells done is you've had active cancer in the last 5 years. It's better safe than sorry. It's not that you couldn't, but we don't recommend doing it because, again, they're undifferentiated cells. You certainly don't want them to turn into cancer cells. But anyway, we won't do them if you've had cancer in the last 5 years. How many treatments do I need? The hope is one, but you can do them multiple times. So some people pound on their joints. Like I have a few guys who've done stem cells so they can keep playing basketball or keep running or keep playing golf, the sports that really torque on the joints. And so, of course, as they regrow, you're still going to wear it out at some level. Downtime typically is anywhere from 1 to 4 weeks, depending on what you're talking about. You're able to drive home the same day. You don't need somebody to drive you there. It doesn't really hurt. But what you do if you're a runner or a golf or basketball or soccer or something like that, 2 to 4 weeks, depending on what sport you're talking about. How long it lasts depends on the severity of the joint. The steps for this are step one. If you're interested in this, you can either watch the video or you can make an appointment. To have joints assessed, we can assess 1 or 2 joints for $50. That includes your x-rays and the assessment and going over your results with me. 3 or more joints is $100. And so the assessment itself is to see if you're a good candidate. And I will be very candid with you. I will tell you if it looks like it would work, if it looks like it wouldn't work. It's just, and again, it's an estimation. My lights are wearing out. So got a little darker here. As far as how fast will I see results, as early as 4 days. You can see results as early as 4 days, but the maximum results is somewhere between 3 and 6 months. Why hasn't my doctor recommended this? I asked this question one time of a very high-level executive at a hospital, and they said, this was her opinion, keep in mind, but she said, quite frankly, we can't make near as much money on this as we do on surgeries. I think it's cutting edge. It's been around for 20 plus years, but we just haven't figured out a way to have it run through insurance, make it profitable for the hospital. But that doesn't mean it's not effective. It's kind of like supplementation. Why doesn't your doctor recommend supplements more? They either don't know, or it's not as effective, or they're not educated like the drug companies educate them. These are opinions, but I'd argue that they're probably facts. What do I do if this therapy is right for me? Again, make an appointment. In our dinner program that we used to do before the pandemic here, we always used to talk about the law of diminishing intent. If you know you need to make an action step, you need to do it within 4 days. The law of diminishing intent states that if you learn some new information, or you know you need to make a change or an action step, you have about 4 days before your likelihood of doing it goes down by 80%. That's why you need to email me, contact the clinic, post in the live feed here, whatever it might be, to get the next action step, or schedule a time to come in and be x-rayed and set the follow-up appointment. those are the main things. Last little bit here, cost comparison. It is expensive to do stem cells compared to some other treatments. It's more expensive than chiropractic. It's typically several $1,000s to have joints. Now, there are, because of extraction fees and things, if you need multiple joints, there are ways to do more for less. If I can give you an example, the last I heard, and I haven't actually seen these numbers, but I heard from a client, at UW-Madison, the price for a single joint is anywhere from $6,450 to $9,300. Because of not having the hospital fluff, we're able to do it for often half or less. So you think about that, you are really getting the best quality for the best possible pricing. And while it is not covered by insurance, with the exception of there are certain Christian ministry plans that cover this. The out-of-pocket for surgeries is often higher than it would be to prevent yourself from surgery, and the success rate, I would argue, is likely better than having surgery in many cases. So cost comparison is effective. It's your choice. Do you invest in your health or do you roll the dice? It's so much less invasive, so much more conservative, and so much better, as a whole. So the second word is health. So second mystery word is health. So I hope you enjoyed the mini masterclass. I hope you decided to take some sort of an action step, whether that's just eating healthier or taking some supplements or making an appointment at the Integrative clinic or scheduling an assessment for stem cells or Mountain or Gut Heal and Seal or the NutriVal. But really, you'll never, ever regret investing in your health, is my opinion. And I certainly appreciate each and every one of you that take time to watch this. You are doing healthcare the right way. Have a blessed day.